Hello and welcome to part 3 of the musculoskeletal block for clinical cases. Today we're going to be taking a look at some more of the musculoskeletal abnormalities, including bone tumours and soft tissue tumours, osteoarthritis, injuries to the muscles, ligaments and tendons that can occur, fibromyalgia and soft tissue rheumatism, carpal tunnel syndrome, and scoliosis, kyphosis and lordosis. So let's get started by looking at bone tumours. So bone tumours can be primary or secondary, and a primary bone tumour is one that originates within the bone itself, and it is normally benign and when the skeleton is still developing, and as a result it's more common in children and young adults. In comparison then, a secondary bone tumour is one that usually originates elsewhere and metastasizes to the bone, and as a result of this it's always malignant, and therefore it's more common in elderly individuals. It's important to know the difference between key terms such as benign and malignant, whereas benign is a neoplasm that does not metastasize but can still exhibit locally aggressive behaviour, and a malignant tumour is one that has a predisposition to invade and destroy local tissues and to try to seed a distant metastasis, in other words distant move via the vascular or lymphatic system to elsewhere as well. So the presentation of bone tumours may be masses, pains, pathological fractures or pressure effects, but often they are incidental findings during admissions for other reasons. It's also important to be able to look at an X-ray and be able to assess a bone tumour, and we do this using Enneking staging, so we can look first of all at the age of the patient, and therefore if it's younger it's more likely to be a primary bone tumour, and this can narrow down your differential diagnosis, and using location in the bone can also narrow down your differential diagnosis. We can tell the age of the patient by looking if there are epiphyseal plates or growth plates still present in the bone. Then we want to know if it's sclerotic or lytic, i.e. does the bone appear whiter or darker on the x-rays, then more bone or less bone. Is there a zone of transmission, and if so is it narrow or wide? So narrow zone of transmissions you can draw around them and it's good. A wide zone of transmission is bad. The impact on the bone, is the bone expanding and reacting to the tumour and therefore it's good, or is it destroying the bone and therefore it's bad? And what's the impact on the tumour? In other words, is there a periosteal reaction as well? So to zoom in on benign and malignant tumours, benign tumours are ones like these at the top. So an aneurysmal bone cyst usually occurs in under 20-year-olds and it's usually appendicular and blood filled, and it can present as a fracture. Simple bone cysts are serous filled in comparison to blood filled ones above, and these present with a fracture as well normally, and they grow as the child grows but then stop once the child stops growing as well. An endochondroma, so this is a benign intramedullary tumour of cartilage, and it's got potential to turn malignant, and there's association with Olliers and Maffucci's. And then giant cell tumour, so this is benign and locally aggressive, eccentric and lytic, and as well it's metaphyseal and can cross the physis as well. With malignant tumours, these, like we said, are more common in elderly patients. So osteosarcoma is probably one of the exceptions, so it can occur in both young and old. There's a bimodal distribution of incidence, and it's classically around the knee. You see Codman's triangle, there's a strong association there, and 70% survive 5 years. We use H and E staining, hematoxylin and iocin, and these patients tend to have mainly iocin and pleomorphic nuclei as well. Chondrosarcoma is a malignancy of cartilaginous tissue, and these are the ones that can be sequential from an endochondroma, which is benign. Ewing's, multiple myelomas and metastases are other types of malignant tumours, and each have their own distinct features. Soft tissue tumours are a group of rare cancers which affect the tissues that connect, support and surround other body structures and organs. So tissues that can be affected include fat, muscle, blood vessels, deep skin tissues, tendons and ligaments. So to summarise a few of these, you could have a leiomyoma, so these develop in muscle tissue. These are benign tumours of smooth muscle that can be found anywhere in the body, but are fairly common in the wall of the uterus and known as fibroids. You can have liposarcomas, so these are developing in fat tissue. Again, they can be anywhere in the body, but most commonly they're in the thigh or behind the knee and the abdomen. And they occur mostly in adults between 50 and 65. Another classification could be an angiosarcoma, so these develop in blood vessels or lymph glands, and these most commonly occur in the skin, the breast, the liver, the spleen, and the deeper tissues of the body. In terms of symptoms, normally soft tissue tumours are asymptomatic to start with, and in the later stages there's a painless lump and swelling, but also there can be pain if the tumour is compressing a nearby nerve or muscle. The risk factors for development of a soft tissue tumour include age, genetic conditions, previous radiotherapy, and exposure to certain chemicals as well. Osteoarthritis is something we should talk about next, and we talked about rheumatoid arthritis in part 1 of the MSK videos, and we said how it's different to osteoarthritis. So osteoarthritis is the degeneration of the joint cartilage and the underlying bone. So this is most common from middle age onwards, and it causes pain and stiffness, especially in the hip, knee and thumb joints, which are most commonly affected. We can grade the cartilage damage from 1 to 4, from softening, fibrillation, fissuring and ebonnated bone. And there's an analogy that compares this to a road, which is useful if you look that up as well. So the epidemiology of osteoarthritis, there's 8.75 million people sought treatment already for it, and a third of over 45-year-olds have sought treatment for osteoarthritis as well. So the articular cartilage is what's really affected here, and the surface changes alter the distribution of biomechanical forces, and as a result we have changes within the tissue. The cartilage damage causes chondrocyte cloning in an attempt to restore articular surfaces. So remember, those normal adult chondrocytes are fully differentiated and do not proliferate. But here they are differentiating and are proliferating. But the problem is they don't differentiate fully, and therefore they can't effectively synthesize the elements needed for the extracellular matrix. The loss of matrix components leads to thinner fibrils and more disorganization, leading to decreased tensile strength, and as a result we get proteoglycan loss as well, resulting in the inability to hold water content, so there's decreased resistance there. The long-term effects of this is that you get bone-on-bone rubbing against each other due to degeneration of the articular cartilage, leading to pain, joint stiffness and loss of function. With regards to looking at this on a radiograph, you'd see narrowing of the joint space because the cartilage is degenerated, osteophytes, subchondral sclerosis and bone cysts as well. The causes can be divided into primary, where the etiology is unknown, and secondary, where the etiology is known. Next we can look at muscle, ligament and tendon injuries. So key things to remember here are that ligaments connect bone to bone and tendons connect bone to muscle. So first of all, a muscle strain. So this refers to damage to a muscle or its attaching tendons, and it's usually due to undue pressure on the muscles during the course of normal daily activities or with sudden heavy lifting or sports. So muscle damage can be a form of tearing of the muscle fibers and tendons that attach the muscle, and the tearing of the muscle can also damage small local blood vessels, causing local bleeding or bruising, and pain caused by irritation of nerve endings in that area. A ligament injury, so remember ligaments connect bone to bone. These are common in athletes and can occur at any joint, and the knee and ankle are particularly vulnerable in sport-specific injuries. So ligaments are strained when the joint is stressed beyond its normal range, and the common cause of a ligament injury includes twisting or landing awkwardly. We can grade a ligament tear 1 to 3 from mild to complete tearing, and we can grade a muscle tear as well from grade 1 to 3, from stretching of small tears to larger and a complete tear as well. And it's important to grade muscle, ligament, tendon injuries to allow us to help guide the treatment as well as aid communication between professionals so they understand the severity of the injury to a patient that's being referred to them. The healing potential of a ligament is dependent on 3 stages. So first of all there's inflammation, then there's repair where type 3 collagen is laid down, then there's type 1 collagen being laid down, which is the remodeling stage and where it's more sturdy. Common ligament injuries, as we've already said, are the knee. So there's quite a lot of ligaments in the knee, the anterior and posterior cruciate ligaments, medial and lateral collateral, and therefore it's important that you're aware of these because it's one of these ligaments that's likely to be injured. Next we have fibromyalgia. So this is a disorder of chronic widespread pain and heightened pain response to pressure. So functional MR scanning demonstrates increased activity in the somatosensory cortex of the brain, the insular and the anterior cingulate cortex as well. So these patients will have chronic pain for more than 3 months. The pain will be widespread in the axial region and 2 contralateral body quadrants, and there'll be tender points on examination where 11 out of 18 roughly or more are tender. They may experience other symptoms as well, such as somatic symptoms like muscle pain, IBS, dysmenorrhea or tingling or fatigue, and waking up unrefreshed as well is quite common. Fibromyalgia is more common in women and affects around 1 in 20 people globally, and there's an increased prevalence with increased age. There's also a higher prevalence, interestingly, according to a recent study, in divorced or lower income or lower education population groups. The cause here is unknown, but the most widely accepted theory is that the fibromyalgia is a central pain problem, caused by excessive levels of pain stimulators or amplifiers in the central nervous system in response to triggers which should normally not cause pain. And it's important to be aware of the different types of pain here in order to understand this condition in a little bit more detail. Soft tissue rheumatism, so this is just a brief overview. So soft tissue rheumatism is a group of conditions that cause pain, swelling or inflammation of the soft tissue around the joints. So as we've already discussed, soft tissue refers to tendons, muscles, ligaments and bursas. So bursitis and tendinitis are common examples of soft tissue rheumatism that occur in clinic, and they can result from overuse or misuse of the joints and the surrounding tissues, and they can occur together with underlying arthritis as well. So different types of rheumatism are listed here. They then describe the type of pain that's involved, and then we describe the examples on this side. I'm not going to go through it because it's quite an easy table to go through on your own, but there's two examples here at the bottom which are quite common in clinical practice. So we've got medial epicondylitis, so the medial epicondyle of the elbow, and this is also called golfer's elbow, and this is inflammation of that medial epicondyle. It's usually as a result of repetitive strain and often linked to occupational risks, and there's pain when the flexor muscles of the forearm are activated. This is in contrast to lateral epicondylitis, which is inflammation of the lateral epicondyle, and this is called tennis elbow, and it's usually as a result of repetitive strain as well, but this time there's pain when the extensor muscles of the forearm are activated, and there's also tenderness over either the medial or lateral epicondyle respectively. Next we have carpal tunnel syndrome, and this is a nerve entrapment disorder that results in the compression of the median nerve of the wrist in the carpal tunnel. It's really important to be aware of what the carpal tunnel holds, i.e. what bones, what tendons, and what nerve is encapsulated. So the median nerve is the only nerve that runs through the carpal tunnel, and it results in pain, numbness and tingling in the thumb, index finger and middle finger. So the reason it's over these regions is because that's where the median nerve innervates on this palmar side of the hand. So the risk factors for carpal tunnel syndrome include obesity, repetitive wrist work, trauma, and there's also a link to myxedema and thyroid disease, and there are different tests you can do both clinically and investigations in order to diagnose carpal tunnel syndrome. It's important to treat it either with corticosteroid injections for short-term symptom relief, NSAIDs to manage the pain, and if it's more severe you may want to do a surgical release of the flexor retinaculum, which is that quadrant band which overlies the carpal tunnel, and releasing this decreases the pressure within the carpal tunnel. Next we have a few spinal disorders. So scoliosis is a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. So this is a condition that commonly arises in young teenagers, and most cases of scoliosis are mild, and some children do develop spinal deformities which may continue in severity as they grow. Severe scoliosis can be disabling, and the signs and symptoms include uneven shoulders, one shoulder blade that's more prominent than the other, uneven waist and one hip higher than the other. So the curve normally represents either an S or a C shape, and in some the curve is stable and in others it curves more over time. 65% of cases of scoliosis are idiopathic and 15% are congenital, and 10% are secondary to neuromuscular disease, and we're concerned about progression of this condition because it can cause lung and heart damage and compression of the thoracic cavity, which makes it hard to breathe and more difficult for the heart to contract as it should do. In terms of treatment, we can watchful waiting. There's also bracing and surgery that can be done, and bracing is normally done when the bone growth is still occurring, and we can prevent progression of the condition any worse. Kyphosis and Lordosis are the last things to look at in this video, and it's important to remember when exploring these disorders that actually the spine has got normal curvature anyway throughout the cervical, thoracic, lumbar and sacral regions. So kyphosis is an abnormal excessive curvature of the spine which is most commonly seen within the thoracic region. It is caused either by congenital abnormalities, so abnormal vertebrae development in utero, poor posture or slouching, arthritis, osteoporosis, and other spinal conditions such as infections, spina bifida and spinal tumours. The symptoms of kyphosis tends to be bending forwards of the head in comparison to the rest of the body, a hump or curve at the upper back, and fatigue in the back or legs. Lordosis is further down, so there's increased inward curvature of the spine, so this most commonly occurs in either the cervical above the thoracic region or the lumbar region below. The common causes here include achondroplasia, spondylolisthesis, osteoporosis, obesity and discitis, and the symptoms occurred include appearing sway back, back pain and discomfort, and problems with certain movements. The treatment really is focused on cause dependent, and physical therapy always helps. That's the end of this video. Thank you very much for listening. If you do have any feedback, please do let me know.